Okay, so this is a continuation of the eye examination. Now, we finished off with the 6 fields of gaze using our finger. So we're going to ask our patient once again to go ahead and face us. Now, we had just finished with the 6, like I said, 6 fields of gaze. We'll go ahead and repeat them though. So go ahead and follow my finger. You can go ahead and hold his chin while he's doing it to make sure that he doesn't move his head. So we're going to go 1, 2, 3, 4, 5, 6. Now that, we're just making sure that there is no nystagmus or the twitching that sometimes we may see in some patients. Some slight nystagmus is normal, but no sustained. That's what we're looking to make sure they don't have. We're also going to ask him to go ahead and follow our fingers from the ceiling all the way down to the floor. Now when we do that, we're making sure that the globes and the upper lips move smoothly down, that there's no lid lag, or that the sclera isn't exposed when they're doing it. Now let's go ahead and go to the next one, the corneal light reflex test. Now that test measures muscle balance. Now when we do this, what we go ahead and do is we take our light once again, we shine it on the nasal bridge on him, and then we're going to go ahead and ask him to look at a close object. Now what we're actually wanting to do is have his eyes converge, and then we want to see that the light is symmetrical on both of the cornea. Now the object needs to be about 30 centimeters away from the bridge of his nose. So let's go ahead and see what we find here. So go ahead, and I want you to take a look at my finger here. Okay, so we see that the light reflects symmetrically on both, but let's say that it didn't. In a patient that actually doesn't have the light symmetrical on both, and let's say that his eyes don't converge, then we would go ahead and move on to a different test. You wouldn't do this test unless this happens. It would be called the cover-uncover test. Now, in this type of test, we're actually testing for strabismus. Now, when we do this, go ahead and face the camera once again. We're going to ask him to stare at a fixed point, let's say to letter E once again. And we're going to ask him to cover one eye. But before we do this, we want to make sure, okay, what we're doing is we're taking a look to see what the eyes do. Now we're going to cover one eye and then watch the other one to see if it begins to move to try to focus on this object. And then after we see that it's focused, then we'll go ahead and remove the other one to see if that one starts to move or do anything to try to focus. And then we'll do the same thing for the other eye. So both eyes should be looking at the same thing always at the same time, whether it's uncovered or covered. So if you note that there is eye movement, that would be a diagnosis. That would be indicative of a diagnosis for strabismus. So let's go ahead and take a look here. So we're going to go ahead and ask him to take a look at the E. Now we're going to go ahead and, the examiner can do it. I think that would be a little bit better. So he's fixed on that E. Now I'm going to go ahead and cover one eye, and I'm making sure to see that he's actually looking at it, and now I'm going to go ahead and uncover the other one. Now I didn't see anything happen there, so there was no eye movement whatsoever. Now I'm going to go ahead and do that with the other one. So I'm going to tell him to